Hello, I am José Prazer. Today, this video tutorial will describe orchiectomy in horses using the close technique with primer closure. The surgical procedure usually takes around 60 minutes. We have no conflicts of interest to declare. The technique described is the one we routinely use at the Lusófona University in the Equine Teaching Hospital. The advantages of this procedure include fast healing, lower infection rates, decreased edema, less pain, lower complications rates, and can be performed by every veterinary surgeon. The disadvantages are the risk of general anesthesia, the need to be performed in a surgical room, and the fact that it is a more expensive surgery. Under general anesthesia, the horse is placed in dorsal recumbence in the operating table, and intratesticular local anesthesia is performed with 20 ml of lidocaine at 2% in each testicle. Following this, the surgical team will perform surgical asepsis and place the drapes. A skin incision is made over the external ring using a bipolar electrocautery device. Digital dissection, identification, and traction of the tunic are then performed. The spermatic cord covered by the tunic is sterilized and the scrotal ligament is ruptured. The cremaster muscle is then isolated from the tunic, emasculated, and sectioned with the bipolar scalpel. Next, a transfixation ligature is performed on the cord using number 1 absorbable monofilament gluconate suture. After transfixation, the cord is emasculated and sectioned with the electrocautery device. Once confirming there is no bleeding, the wound is closed in 2 layers. In the first layer, a continuous simple suture is performed with the number 0 absorbable monofilament gluconate suture. Then, a subcutaneous cation pattern suture is performed with a 2-0 absorbable monofilament gluconate suture. The procedure is repeated on the other side. Possible complications include hemorrhage, seroma formation, edema, surgical site infection, and if the accidental opening of the vaginal tunic during the dissection happen, this does not compromise the procedure. Operatively, the patient will be administered phenylbutazone 2.2 milligrams per kilo once a day for 3 days and benzyl penicillin G procaine 22,000 international units per kilo for 3 days. The following day, the horse will begin to walk, and then by the end of 5th day, it will be able to resume light work.